Overall, what we see in the phase 1 trial is no significant, at least acute toxicity. So we didn't hit any dose-limiting toxicities, and most of the toxicities were really limited to grade 1. About half had xerostomia, or dry mouth. About a third had some nausea, and then there were some other lower, smaller numbers with low-grade toxicity, as has been seen in the other prospective phase 2 study from Australia. So we know that by watching these patients and monitoring them regularly, which we did every week for a month, and then every 2 weeks for 2 months, and then monthly thereafter, we are picking up on a higher rate of these toxicities simply by asking the question. But the majority were really grade 1, occasional grade 2, and reversible. We saw overall in an unselected population, the majority had PSA declines, about 70%. About 45% had at least a 50% PSA decline. We also saw a decline or control in circulating tumor cell counts by the cell search methodology compared to baseline as well at 12 weeks. The data are for progression-free survival and overall survival are not mature, but with the single cycle of therapy, the data looks similar to what we see with 4 to 6 cycles of therapy at lower doses, with about a 5.5 month progression-free survival by PSA and about a 15-month overall survival. But really that follow-up is ongoing. As I mentioned, we're now taking that 22.2 gigabecquerel per cycle dose into a phase 2 study, which is being run through the Prostate Cancer Clinical Trials Consortium.